Quote, the Trump administration shelved a document created by the nation's top disease investigators with step-by-step advice to local authorities on how and when to reopen restaurants and other public places during the still raging coronavirus outbreak. Agency scientists have now been told that the guidance, quote, will never see the light of day. Last week, the AP was reporting that the quashed guidance was this 17-page document which provided detailed instruction for child care programs, schools and day camps, faith communities, restaurants and bars, mass transit. Are you in charge of or do you work in any of these kinds of places? Here's what you need to know about opening up safely. It's written. The White House shelved that guidance. Well, now, thanks to further great reporting from Jason Deeren at the AP, we know that the CDC's guidance was even more detailed and more robust than we thought. Jason got hold of a 63-page document that never made it out of the CDC and into the light of day, and it soon becomes clear why. Quote, the White House's Opening Up America Again plan that was released April 17th included some of the CDC's approach, but made clear that the onus for reopening decisions was solely on state governors and local officials. By contrast, the organizational tool created by the CDC advocates for a coordinated national response to give community leaders step-by-step instructions to help Americans re-enter civic life. Coordinated national response. Well, we can't have that, can we? I mean, here's just one example from page 5 of this CDC document. Quote, travel patterns within and between jurisdictions will impact efforts to reduce community transmission of coronavirus. Coordination across state and local jurisdictions is critical, especially between jurisdictions with different mitigation needs, end quote. And that's easy to figure out, right? If you have an outbreak in one county or one state, you can't have 50 different containment plans across the country or across a state, not unless you are planning to hermetically seal certain counties or states. And so the CDC plan is very, very cautious about non-essential travel, whereas the White House guidance just says that if virus cases in your area have declined for a few weeks, travel at will. Quoting from today's AP report, quote, as of Tuesday, CDC's webpage on travel guidance during the pandemic still linked to the White House plan. The stricter guidance is not there. Now, the White House is clearly at odds with the CDC. It's buried the guidance that experts at CDC have been trying to get out to the public for a month now. But the CDC leadership may not be covering itself in glory either. Why hasn't this guidance been posted on the CDC's website? Why is the CDC director, Robert Redfield, dodging questions from senators like you heard on this today? What is going on at the CDC? Joining me now is the person who probably knows more about this other than anyone at the CDC, Jason Deeren, reporter for the Associated Press, who's broken these scoops about why the White House is burying this CDC guidance. Jason, thank you again for your time tonight. The CDC director, Robert Redfield, said yesterday that the new guidance would be coming soon. What do you make of that? What does soon mean? Is there really an effort to get this guidance published? Because it is, as you are reporting, remarkably detailed information that people need.
Well, first of all, thanks for having me, Ali. I appreciate it. Yes, there has been an effort at CDC to get this guidance published for weeks now. And what the emails I obtained showed is that, starting in early April, the guidance was sent up to the White House for approval from CDC. And it got caught in kind of a logjam there for weeks. And by the 30th, that's when CDC was told it will never see the light of day, according to 3 different CDC officials who spoke to us on condition of anonymity. And it was only after our first report about that being buried on May 7th that we heard that the pieces of it were revived again. So there is some move now to get some of the decision trees and other pieces of this out, but we still don't know when that would happen. And other than, we've released it with our stories, we've linked to the documents so people can access them that way. But in terms of official release on CDC's website, I don't know.
That's kind of amazing. And I'm grateful that we can see this stuff on the Associated Press, because there are restaurants and bars and churches and mosques and synagogues and child care centers that can use this information right now in real time. You've reported that states have contacted the CDC, sort of pleading with them for guidance on what they're supposed to do. What do they get when they call the CDC?
Well, if they call the CDC, I've been told they can get a lot of the guidance that would have been published otherwise if the White House would have allowed it. But we're talking about officials in every jurisdiction in the country, right? So counties, cities, states, that's a lot of different officials making a lot of different decisions. And for the CDC to have to field all those kinds of calls and give that out over the phone to each individual local health department isn't very efficient, and it certainly isn't a coordinated kind of efficient response. So what we have instead are an agency that has the expertise, has done the work, but hasn't been able to put it out yet.